what I'm talking about here are the fact that, you know, generic pharmaceuticals exist, the generic antiretrovirals, and for those that don't know what they are, I'll let you explain. But you know, the fact that you could cure a hell of a lot of the AIDS in Africa if the pharmaceutical companies allowed those generics to be used, and it's those pharmaceuticals companies that have the grip here in the West as well in setting the price, you know, to the health services. So is there not, you know, do we not have to have more leverage and power over the pharmaceutical companies to cure AIDS?
It's not the pharmaceutical companies that are having unprotected sex at 4:30 in the morning and getting infected, right? So I take your point, and it's a point that was a lot more important about 10 years ago than it is now, because at that time a lot of the pharmaceuticals that were being used in developing countries were actually, because of the US congressional process that I described, were actually being bought from Western, and particularly US manufacturers, at Western prices. So that was obviously, because they were so expensive, it was reducing the number of people who could treat for the same amount of money. That's actually more or less gone. So in fact, most of the meds in developing countries now are generics.
Well, I'm referring to the film. I can't for the life of me remember what the documentary that was out last year. Excellent documentary. Are you saying that that's kind of out?
Yeah, I think you're talking about how to survive a plague. Was that the documentary?
No, it doesn't sound quite right. So it had the word elephant in it, I think.
Oh, I don't know. I miss the elephant documentaries. I shy away from.
Well, it wasn't about elephants, but it had.
But I don't know. I mean, it's certainly at the beginning. I mean, it is not true that we can cure HIV. That is not true. We cannot cure AIDS. We can reduce the likelihood that you will die of it very, very, very significantly. With all the provisos that were in that New York ad of osteoporosis, liver failure, all of these other things. The drugs are also getting less toxic. I think that it's very easy. We're always trying to look for scapegoats for this big and terrible thing. And it's always very easy. Unfortunately, we can't blame big tobacco for this one. I've looked for ways, and we just can't find a way to blame big tobacco. But next in line is big pharma, and big pharma have been very guilty in this, of keeping prices high, of slowing down progression to generics. But actually, this is not a problem of the pharmaceutical industry. This is a problem of risky behavior among people who choose to continue to behave in risky fashions. Yes?
You talk a lot about like risky behaviour. I know you're only talking about this particular issue, but surely like most big problems that are facing, particularly the West and emerging countries as well, particularly as they get wealthy, it's like diabetes type 2 mostly, it's smoking, things like that. Surely that's risky behaviour as well. I mean, it's not fair just to talk about people who hate HIV.
No, that's absolutely true. I mean, I just happen to work on HIV,
yeah.
so no, absolutely. I can't cover all the risks, but you're absolutely right. And I think that actually in this country, truthfully, we're relatively well off because there is some kind of quite a high awareness because of the National Health Service. There is an incentive to finance prevention at the state level. Now, the fact that prevention campaigns are designed by nerds and not humans is a problem equally for diabetes and everything else. You know, we've got to find better ways of communicating risk and aligning incentives for people so that they reduce those risks. But we're still better off here. In the US, for example, it's very, very, very difficult to finance prevention campaigns because the cost isn't a public cost. The cost of failure of prevention is borne mostly by individuals and their insurance companies, rather than by the state. So the state has no great interest in financing prevention. But you are right that particularly in Western countries, more and more of the things that make us ill, that kill us, that cause us discomfort, etc., have behavioural components at least. And well, now of course our gene pool is competing for attention, and we're going to find out that actually, you know, HIV is genetic too at some stage. But no, you're right. Behaviour is something that goes across the board, and it's very funny because we call it AIDS exceptionalism in my field. We've managed to make it absolutely unthinkable to stigmatise risky sexual behaviour because but we don't find it unthinkable to stigmatise smoking. It's absolutely fine to ban smokers from restaurants, to make them stand outside in the rain. It's fine to tell kids to be rude to smokers and whatever. We don't have a problem with stigmatising other things. Fat people, that's still a problem. We still can't stigmatise people who eat badly, but we'll get there, you know. And actually, sexuality is the one hallowed thing that we're not allowed to stigmatise. Well, I'm not stigmatising your sexuality. I'm stigmatising the fact that you fuck 4 guys in one weekend without using condoms. You know, that's just bad mental behaviour. I don't care who it is that you're having sex with. I care about the fact that you're doing it irresponsibly. Yes.
I was just
Sorry, I'm sorry, Rob.
We'll go with yours.
I just wanted to talk about the US in particular. I mean, because you have to fund your own medical costs yourself, surely that should be an incentive to prevent contracting the virus.
Yes, you would think that was correct, wouldn't you? But because of AIDS exceptionalism, in New York City, for example, they call them the Benny Paws. The Benny Paws is someone who's, you know, friends with benefits. Well, it's like positive with benefits. If you're HIV positive, actually if you have an AIDS diagnosis, which is super complicated, you get free housing. You get free healthcare. So there's this weird, perverse incentives to actually be positive, and it's true in parts of sub-Saharan Africa as well. HIV positive people get food supplements, in some cases get salary supplements. So you've got these strange perverse incentives that go with the whole funding of the AIDS industry, which is something that I didn't get to, but thewisdomofhorrors.com will tell you a lot about it, or buy the book. But you know, there's a whole industry around HIV and AIDS, you know, which is full of people like me, sadly no longer, you know, earning substantial salaries and perpetuating institutions, and they want to keep AIDS special. And so we're perpetuating, partly because of that, these very perverse incentives that make it more hard to make the rational arguments that you're making. Yes?
So in 2000, HIV/AIDS was kind of spoken about as a security issue by the US security.
Oh yes, that was a good one. Yes, it's a security problem. Yes, quite right.
And
bollocks, that was.
Yeah. It's bollocks because it doesn't talk about, they focus on the military and how an issue of kind of state security, but actually didn't really talk about individuals and specific groups, and more importantly, how those specific groups might be more vulnerable because of the kind of human behavioural issues around sex and drugs. And those are the sorts of things that government, as you said in your book, that politicians just don't really want to talk about. So my question is, how do we get politicians in those higher echelons to securitise HIV/AIDS as a problem that is about time to discuss it?
Well, if you've read the book, you'll know that we did try several different strategies, and they all backfired on us. The reason that they backfired on us was because we tried to make it into things that people cared about, right? So it was much easier in sub-Saharan Africa because, you know, we could play the innocent women and children card much more easily. Although, and I did cut these slides out because I wasn't going to have time for them, but I can show you now if you want. But I'll just tell you that in sub-Saharan Africa, the single greatest risk for a heterosexual guy is to get married. Because HIV prevalence among unmarried women, unmarried women between 15 and 24, is almost 4 times what it is among unmarried men. So this whole innocent women thing, actually it's much, much more frequent that a woman brings HIV into the marriage bed than a man does in the African context. So we've told lies even about that. But we found it much easier to make that argument there than in the West. But we tried. I mean, you know, HIV is everyone's problem, everyone's at risk, etc. was something that we tried to do to get more people on side and interested and funding and whatever. The problem with that is if you tell lies about who's really at risk and who's really infected, you do get more money, but you can't use that money sensibly because it gets diverted to populations that are not actually at risk. So we haven't solved that, and the only thing I can say is we just have to make a case that hookers are human too. Even gay boys, imagine, oh my God, you know, even gay men deserve our attention and public health services. Oh, even people who choose to use recreational drugs. Yes.
Yeah, I am just I come from East Africa, and I just feel the problem with East Africa in particular, where I'm coming from, is very big than even people know. Because in a current research that was carried out by UNICEF Uganda, trying to track violence in primary schools, the results are saying 67% of sexual abuse violence is perpetrated by teachers. Much as the research, the big wide research is saying marriage, women, what, there is a risk in schools. We are looking at schools as one institution that could really be a source of information for young people. But if children between 7 and maybe 12 years have such statistics on sexual abuse and from teachers who are taking responsibility over their sexuality, then it puts countries in East Africa at risk, and Uganda in particular.
I'm sorry. I completely agree with you, but it's not risk for HIV. In that case, HIV is something that you really, HIV is not the issue here. The issue here is sexual violence against young women. That's something that's an issue regardless of HIV. You don't need HIV to put that on the agenda. That's something that you guys, as a nation, have to be putting on the agenda because it is wrong. It is wrong for teachers to be abusing their students anywhere in the world, in any age group, with or without the risk of HIV. Am I right?
You are right, but I'm telling you, I'm associating the two.
Right.
I'm showing you the risk behavior of, violence against children. That is doing one. And then we are just assuming, supposing one teacher is infected and is abusing like 10 girls. By the time they finish secondary education, watch the trend of HIV.
Right, but I don't care about HIV in that circumstance because the bigger problem is the problem of the sexual abuse. That's a problem that as a society you need to be dealing with regardless, with or without the HIV problem. And the reason that I react the way I do is because very often, because there's been so much money for HIV, we've stamped the HIV label on every single thing that you could possibly imagine. Fisheries and HIV, children and HIV, the environment and HIV. Actually, I made a joke in my book. I've also got a slide about this, but I made a joke in my book saying, oh, the next thing I'm waiting for is global warming and HIV. And 2 months after it was published, headline story in the Sydney Morning Herald, global warming, no, was it global warming fans the flames of HIV or HIV fans the flames of global warming? I can't remember which way around it was. But, we don't need to associate all these things to make them important. These things are important in their own right. And that kind of goes back to your question of, we need to do these things because they're the right things to do. We need to provide sexual health services for gay guys in the same way that we provide sexual health services for straight women, because it's the right thing to do and because people need those services. And I think that would help to resolve the problem. So I'm not belittling what you say at all, it's absolutely true, but you need to deal with that problem in its own right, regardless of the HIV thing. Yeah.
Just wondering if you personally hold any hopes that in the future, near or far, there will be actually a cure for HIV as a virus itself?
I'm not enough of a virologist to be able to answer that question. There are a lot of very, very good brains working on it. I think, you know, this, you could come back to the pharmaceutical conspiracy theory issue here. A lot of people think that actually a cure would not be a very rentable solution for big pharma. People aren't working on it as hard as they might be, but a lot of people outside of pharma and academic institutions are working on it. It's a very complex virus, and it mutates very, very rapidly. So it's a miracle that we've done what we have with treatment in the space of time that's been achieved. I think probably HIV, for the level of complexity of the virus, I think it's probably been addressed more rapidly and more successfully than any other. Am I right about that? I'm sure someone can give me a counter example. But we've done very well. Can we go that last? I don't know. We're not doing well on vaccines either, which is problematic. Yes.
I think Pope Benedict XVI in 2010 said that he actually supported the use of condoms in extreme circumstances when it is preventing HIV. Do you think has that actually had any impact on stopping the spread of HIV, or is it just an off comment which doesn't actually affect it?
In my experience, in my observation, and in some of my data, but not much because I don't work much in Catholic countries, that whole thing, so we have this thing, and I've even made fun of the Pope in public for undermining the use of condoms. But actually, you know, I'm a Catholic, and I don't know, how many Catholics are there in the room? Not that many, God, look at that. Okay, but I mean, and how many of you stick with every precept of the church as far as procreation and contraception and sexual behavior goes? I think that, oh, I can't use a condom because the church tells me not to, is a convenient excuse for people who aren't going to use condoms anyway. Because quite a lot of people who say, I can't use a condom because the church tells me not to, or on the pill, you know, or you're going to a hooker, but you can't use a condom because the church tells you not to. I think it's been a convenient excuse, but I don't think I don't think the dictates of the church have that much effect on the behaviour of the people who are actually at risk for HIV, truthfully. Although we love to make fun of them.
Even in the sort of third, I understand what you're saying about modern countries, but maybe in a third world country where.
Well, certainly Latin America, absolutely not. The only place possibly that I can think of would be the Philippines, because there the opposition of the church has actually made condoms difficult to get outside of red light districts. They are universally available and universally used inside red light districts, so I don't think that's, I don't think it's nearly as much of an issue as we made it. I don't think it helps ever to have people in authority you know, giving people excuses not to use condoms. Oh, they're full of holes, the virus is smaller than the particles of latex, and therefore, you know, all of that nonsense certainly doesn't help, but I don't think it actually explains as much of the failure to use condoms as we would like to think, truthfully.
We've wrapped up on time. I'm sorry we went 10 minutes over the advertised time we put on the website. Thank you, Elizabeth, for the talk. We can come around